Hi, my name is Ryan Harlan, and I was recently treated here for a knee injury that I suffered about a year or so ago. About 1 year ago, I suffered a skiing accident injury in which I had a complete patellar dislocation and some cartilage fraying. That cartilage fraying turned into a lot of cartilage degeneration, and I had two very big gashes in my articular cartilage in my right knee. I went to Dr. Dar, and Dr. Dar suggested that he perform microfracture surgery on my knee, which is a little bit of an older procedure that's become more refined through better medical technology, better imaging, and whatnot. So last December, currently it's May for reference purposes, but last December I went in and did microfracture surgery there at the end of the year. Lots of common side effects after that: swelling, kind of not really doing much. But the end result, but before I got to the end result, I ended up going in and doing. I also went in and did some. They did the stem cell therapy, which involved taking fat stem cells and bone marrow and injecting that into my knee. And the main reason they did this was after I had that initial injury that was back in like the February previous, and that led into continuous joint pain as the knee cartilage there was going away. There was also a piece of free-floating cartilage that I didn't even know was there. It didn't show up on the MRIs, and that was moving around in my knee, causing random stints of pain, whether it would be doing yard work or doing, dancing, running, anything like that. So I kind of recovered fully from the initial injury, but then I was still having pain, and that's when we went and did the microfracture surgery. So they went in, they did this surgery, I did the stem cell therapy about 3 weeks later or so, right after you kind of get going again. You kind of get a little bit recovered from that first original surgery. They did this stem cell therapy, and then you kind of wait. You let the recovery time happen. You start going to physical therapy, but the recovery after it was fantastic. There is an event I wanted to go to near the end of March, and I was there, and I was able to go there and enjoy myself, do lots of walking, no pain, very mild discomfort, and many of my normal daily activities. So I really enjoyed how fast the recovery time was right after, and I was very surprised. Dr. Dar was surprised, and again, for reference, I'm 24 years old. I was injured when I was 23, so I'm a bit on the younger guy. So if there's anyone out there that got hurt when they were young, I would say definitely go to Dr. Dar. He's very understanding of sports injuries, outdoor adventure sort of injuries, things like that, and very, very patient with his patients, and as well as very open to answering lots of questions, any sort of concerns you have. Why do I need this? Why do you suggest this? What exactly goes into this surgery or this procedure? And he was absolutely fantastic. I thoroughly enjoyed talking to him, talking to all of his nurses, and practitioners here, and as well as another thing I should also mention before I finish up was I also did do the ARP wave treatment, and that was it is a physical therapy, but it is not a light physical therapy. It is strong, it is enduring, you push yourself, you have a high protein diet to get that muscle mass growing, but it saves a lot of physical therapy time. And it was difficult and enduring, but if you push through it, it is fantastic the results you have after it. After about, you only do about 10 sessions or so, but it is worth those 10 sessions that you do in just 10 consecutive days, or it's worth about 4 to 5 weeks of physical therapy. So it saved a lot of time, and I was able to get back on my feet that much faster. So I definitely would recommend Dr. Dar and his associates for any sort of stem cell treatment, knee treatment. Again, this was a right knee patellar dislocation that turned into a microfracture surgery. I had stem cell therapy and ARP wave, and I couldn't ask for anything better. Thank you.